Hey, y'all. Welcome to Questions You Didn't Ask. Did you know that this very spot could be showcasing your business or event? Whether it's an audio ad on our podcast or a visual ad on our new YouTube station, or even both, we've got the space for you. Niasha Fray Consulting is reaching a growing audience of over 1,000 leaders who are passionate about health equity, social justice, and civil rights activism. These are professionals just like you, working across higher education, research, healthcare, nonprofit, government, and even public health sectors. If you're ready to get your message in front of a dedicated and engaged audience, send me an email at niashafrayconsultingllc@gmail.com. Let's talk about how we can help you connect with the people who need to hear about your services and products that advance health equity and wellness. Don't miss out. Get in the mix and let's make an impact together. Welcome back to Questions You Didn't Ask with me, Niasha Fray, and my guest, Julissa Soto, as we continue the series, Ready or Not, the real talk Black and Latino communities need. Let's pick up where we left off. You mentioned your work in vaccine care, and one of the things that was an eye-opening experience to me was how when COVID, hit, especially here in North Carolina in the Triangle area, and we saw the disproportionate impact among Black and Latino communities and how it was literally killing us. And we started to receive funding. And a lot of that funding was meant for us to work together. But what I saw amongst my colleagues who were managing those funds, who were managing those programs, who were creating those collaborations, was that once we got the resources, everyone went to their respective corners and didn't really share. And it created some challenges where, from my perspective and those of my colleagues, that Latinos were, at least in this community, in these situations, were willing to come to our events to get resources. But when they had their own, they didn't really invite us or make it accessible to us in the same way that we made it accessible to them. And so it put a really negative taste in the mouth of researchers and healthcare practitioners that are Black and we're trying to work together. So let's talk a little bit more about solutions. I really like to talk about solutions. We've identified a number of the barriers. We've named racism. We've named sexism. We've named propaganda. We've named political division. What do you think are things that we can do? We need to be more innovative, right? And how we engage each other. You talked about the conferences and the conversations and the honesty. Let's get a little bit more. What inspires you? What motivates you? What are some of the things that you think that we can do differently to try to meet our community's needs as it relates to health equity?
What really motivates me, continue to motivate me, is that discrimination and the racism and classism and everything above and beyond that comes our way. And I don't know why that happened in North Carolina, but in Colorado, when COVID hit, everyone was vaccinated at a 90% rate, but the Latino community was vaccinated under 50%, like around
Wow.
47%. And so in here, it the opposite happened. Others run with all the resources and they left us behind. So
Mm,
each state will have their own story, right? And that's
mm-hmm.
before I work with vaccines. My work was with behavioral health. The reason why is I am one of the suicide prevention commissioners for the state of Colorado, and I take the attempt seat survivor, right? So I used to do a lot of work about being the voice of the voiceless, speaking up, and it can happen to you, doing all those campaigns in Spanish. And then COVID hit, and I keep hearing that Latinos were vaccine hesitant. And that would have upset me so much that I said, okay, let me organize one clinic only so I can show the state and the health departments there is not hesitancy. Please stop putting labels on us. It's not hesitancy, it's the access. So they came to me, the state, and say, okay, you can organize one clinic and show us, right? Thinking I was not going to be that successful because my expertise, my cup of tea was not vaccines and organizing clinics, it was behavioral health. So when I started, I said, okay, well, I'm gonna organize one clinic. I call my buddies, I call the MDs, the RNs, and I call all the healthcare professionals that could help me. And I said, okay, let's organize this just one. It's gonna be only one clinic. And then after that, my plan was to back off and and continue my work, right? I already show you how to do this. Well, my first clinic, I vaccinated 1,279 Latinos in one day.
Get out of here.
Yes. So I went back to the state and I said, I have here 1,279 Latinos. Now you know it's not vaccine hesitancy. Please stop giving us labels. I
Mm-hmm.
would ask you to stop that. Now you know it's access and meeting people where they're at and
Mm-hmm.
approaching them with respect and dignity. Until date, just by me thinking I was going to organize one clinic, I have organized 430 vaccine
Yes.
clinics in the state of Colorado. I have vaccinated more than 40,000 Latinos, have distributed more than 230,000 home COVID 19 test boxes and 120,000 surgical masks. So I continue strong, getting better, fighting systems. So in Colorado, it was being innovative. Like I said to you, I pivoted and I went to the nightclubs, I went to the meat markets, and I went to the places that the state and the health departments didn't want to go to, like the hood. So, I'm telling you all this and I'm explaining all this because so you can see then some of the states, it was the what happened in North Carolina, but in Colorado, that left us a very bad taste in our mouth by saying we were the last ones. Nobody cared that we were dying here in this state. It's a very difficult state, even though they say, quote unquote, it's a blue state. It's super conservative,
Mm-hmm.
and it was extremely hard to get vaccines to the hood, to my community, but I have done it, and because of that work, the mayor of Denver declared Julissa Soto Day, September 15th, for the city of Denver.
Yes.
But then the governor of Colorado turned around and say, I want a Julissa Soto Day for Colorado. So I have two dates: September 15th for Denver, and September 20th for Colorado. Name
I
after
love
me.
it. Let's go, Julissa. Let's go. I love
Yes.
it. One thing that I just want to lift up because I'm very passionate about behavioral health as well, and that people think, and sometimes us as practitioners and advocates think that behavioral health is different than healthcare. And the thing that you just proved is that behavioral health is healthcare, right?
Yes, it is.
Right. And so it seemed like a big pivot, but in reality, it was just a slight pivot. And it also showed just the power of, like you said, meeting people where they are at. And I just have to repeat the point of approaching people and working with people with respect and dignity. I mean, you brought that up even in regard to how Latinos go
Yes.
to the meat market for healthcare. You know, that is a place where they can be themselves. And Black people are familiar with that, you know. I think in my approach, it's never to say that we should be unified to the point that we don't respect our own culture and that we think that we should all have the same culture. Not at all. There's certain conversations that we have to have within our own communities. There's certain features of our own culture that we have to hold on to in order to maintain our authenticity and keep that sense of comfort for people. But you said it, you went there, you literally went there. And I think that that is both a effective, health advocacy, community outreach and engagement strategy, as well as a political strategy, because you said it, that somehow people didn't listen to what Kamala was saying. But maybe it was where she was saying it that was a troubling or problematic. I don't know. I think she did a great job. I'm sure you do too.
I think so too.
Right.
I think she represents us well, and I honestly and truly admire that woman, because it's like, oh my goodness, lady, you're going against this dog who don't care about anything. So, for me, I will always remember how she stood strong and how she lead with elegance, you know.
Yes. Yes. I agree wholeheartedly. I also just want to draw attention to the fact that you did what I oftentimes advocate for, which is do not continue to do the same thing over and over again, expecting a different outcome. You were awarded and earned the resources. You made the argument and earned the resources to do what others were afraid to do or just refused to do, right? And that is you stepped out of the traditional setting, the traditional approach. And when I say traditional, I mean Eurocentric, right? Traditional American systems that are built around the comfort and privilege of white people. And I speak about this even in regard to an experience that I had as a breast cancer and health advocate in the faith community. And I will share this story about my church, Christian Faith Baptist Church, had a longstanding partnership with a local healthcare provider that provided free mobile mammograms to our church members annually. If people had insurance, they were able to file their insurance, but if they did not have insurance, they were still able to get their mammograms. And what I learned was that many of these women that attended my church and in the surrounding community relied on those events, those annual events and partnerships to get their mammograms. They weren't going to their PCP. They weren't going to, they were waiting to go with the church and waiting for the mobile van to come and show up and be a part of our day. And it was usually very convenient. It was at our church. People could make their appointments months in advance. We facilitated the paperwork, and they were able to either go after church or before church. And some people even had their appointments during church. So they were already there. We were meeting them where they were at. And this one year, the same partner, who is a white-led healthcare agency, told us just weeks, like 1 or 2 weeks before our scheduled event, that we would always end the event and schedule it for the next year. So it had been on the schedule for a whole year, that they weren't going to come. And they told us that instead we could tell the women to come to them at their specified location on their terms.
Oh no, 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 no. The status quo got to go. Why do we need to come to you when we don't know who you are? You're the one building the relationship with us, not us with you.
On top of the fact that we already know what works.
Right?
We already know what works. So why are you changing up now?
Pure
And so
disrespect. You know what it is. You know what it is that they will never admit that a black woman or the Latino woman can be successful, can pivot, can multitask, can do all these things, and still go above and beyond for their own communities. It's just almost impossible. It's a lot of jealousy in there too, my friend.
oh yeah. Well, I mean, and it's crazy because this was a long-standing relationship. So it wasn't even like you don't know us. Like you have the data. We have the data. And so I did my best to advocate, to call and speak to as many higher ups as I could to say, look, these women have already submitted their paperwork. They have already been anticipating that they would get this breast cancer exam. And this was going to be my first mammogram, right? And I
Mhm.
was so disappointed. And would you believe that the very next year I was diagnosed with breast cancer?
Oh my goodness. Bless your heart.
Right? So, I mean, people don't really no, they do understand. They understand when they're taking resources away from the community and away from these community-centered environments and these community-rooted events and organizations, what the health impacts are. You know, as a public health professional, I went to them with the statistics, with the epidemiology for our state, for our county, and said, you have to see that these Black women are at higher risk of dying from breast cancer. We don't get breast cancer more often than any other group. We just die from it more often than any other group. And the fact that you're telling us that we're going to have to come to you at some time that doesn't work for us is letting us know exactly how you feel about our health.
Exactly. And pure disrespect again. Where is the respect and the dignity here, you know? And what is sad is that the first programs that they say no to is BIPOC communities, you know? Those are the ones that struggle the most. The poor keeps getting poorer and poor health. When I say poorer, is like poor health.
Yeah. If you're enjoying the show as much as we love creating it, consider showing your support by buying us a cup of coffee. Visit buymeacoffee.com/Niasha Fray O. That's buymeacoffee.com/Naisha Fray O. All one word. Each cup is just $5, and every single one helps us continue to produce, develop, and sustain the high quality content you've come to expect from Questions You Didn't Ask. Thank you for your continued support, and let's keep the conversation going. And it's also the hidden truth of our communities where people see those statistics, they speak those statistics, health statistics about who's dying, who's sick, who's obese, who's unwell, who's dealing with substance use, who's dealing with depression and anxiety, who's dealing with schizophrenia, who's dealing with all of these other health issues. And it's constantly people of color, especially Black people, Indigenous Native people, Latino people. And the idea is you somehow did it to yourself. There is
Yes.
no accountability on the part of the system to actually do anything different. And what used to blow my mind was, especially when I was in graduate school studying health behavior and public health, there's so much data that they teach you outright about what works and what
Yeah.
doesn't work and what the effect of it is. And then those same people go and take jobs in healthcare administration, health policy, and they run programs and they're at the state level and they continue to do the opposite. And then they continue to produce the same outcomes. And then you have churches and you have people like Julissa and you have all these other folks that have joined my podcast over the years that have said there's another way to go about it. And when it comes time to allocate the resources, when it comes time to vote, when it comes time to do all the other things that are necessary, all of a sudden there's crickets. But the idea, like you just said about the vaccines, is that, oh, well, there's vaccine hesitancy. Oh, well, it's because they don't trust us. We don't know why.
Yes. Yes. And that was the idea. And I also feel that it's easier to say that it's vaccine hesitancy, that is one way or the other, in order for them not to come out and meet people where they're at. Because it really is like a pain in the butt, you know, like for them to come out and serve the community where they're at. I just don't understand, how is it that you're a public health servant, but under your own conditions?
Right.
Public health servant is that you're serving everyone out there, right? So I kind of don't understand that. Don't understand why is it that they don't want to work on Fridays, Saturdays, and Sundays, because immigrants, refugees have crazy working hours. You're not gonna
Right.
meet them Monday through Friday, 8 to 2. You
No.
know, you need to be out there hustling, vaccines, clinics, Friday nights, Saturdays, Sundays. That's where you need to be out there meeting the community where they're at. But many of us say that we meet them where they're at, but that's not necessarily true. Health departments want to be spoiled. Health departments feel that they work so hard. I don't know how, but they feel that way. And they feel that way. And then they think that I'm the rude person that wants these clinics on the weekends. How am I being rude because I want to organize clinics on the weekends? How is it? Or aggressive. I get labeled too. I get lots of labels. And so they say I'm very aggressive, that I get upset if they don't serve my community. That's not necessarily true. I get upset when I see you that you're discriminating when you're providing the vaccine. Number two, I get very upset when I see that you have the staff to work on the weekends, but you're always telling me that you're at capacity, that you're short staffed. You're coming up with all these lies because you don't want to be out there serving the marginalized communities.
You said it. I mean, what else can be said, right?
Yeah, and
So,
and I know that when some of the healthcare providers hear this podcast, I'm not assuming everyone, but I'm saying the things the way that they had happened to me here in the state of Colorado. My community don't can get a chance, especially with the health departments. The health departments have a lot of work to do, and it's sad that they don't see it. They just want to go back to the status quo. They're like, okay, the pandemic is over now, let's move on. And I said, no, I am not moving on. How about let's moving forward together? Don't move on. When you say I'm moving on, it's like, okay, this didn't happen, let's go. Well, we have to move on. How about moving forward? That's a better word for all of us to keep working together. And believe it or not, even though they say the pandemic is over, guess what? I'm still struggling. I'm still struggling getting the vaccines out there
mm,
on the weekends. As we speak right now, I have one clinic going, and one of the food trucks, they have like it's a big space where they sell all kind of food. So that's where I'm having my vaccine clinic. And I don't ask the community to register because I know that they have a lot of traumas with the law, with immigration. I don't want
hmm
them to think it's a setup. So it's first come, first serve. And I'm still getting a huge line. I'm still providing 200 to 300 vaccines doses,
right.
so I am like, and don't tell me that we were ever hesitant. We still struggling with access.
So when we think about, again, getting back to solutions, I think one of the solutions that we have is the thing that we have been saying lately in the Black community is listen to Black women, right?
Listen to Black woman. Yeah, that's a good
Yeah,
solution.
right. And I would say the same thing for you, Julissa. The point is listen to the people who are closest to the problem. Listen to the people who can identify with the experience, right? So that you have solutions that fit the problem. And as we talked about before, not every Latino and not every Black person is suited to be able to engage with the community and meet the community where they are at. So we have to be very clear about having a community mind, but also having funders and supporters that will allow us to move forward, or what some of my previous colleagues have shared, fail forward. I've talked with recently a native tribe here locally in North Carolina, and they talked about some of the challenges that they were having regarding getting vaccines out, flu shots, and different things like that out. And I know that I have a big imagination. And with a big imagination, you oftentimes need a big purse, right? And so one of the things that I shared with them was like, what are some different ways that we can go about giving people a little bit of what they want so that we can give them what they need, right? And we also talked about how can we have funders that would allow us to fail forward. So if you have an event and you're not Julissa Soto, right, with the magic touch, and people don't show up, can you still get some new funding to work out how to make that successful because you know the need is still there? When you have talked with community partners and consultant, I mean, you have gone all over the world. What are some of the solutions and strategies that you have either been inspired by or shared with others that make you feel like we can conquer these these challenges that we're facing, new laws, new policies, new strategies, new funding models. Are there anything that really stand out, or even something that you're working on or starting to innovate now?
Being like you say, my work is global. I was doing some vaccine clinics in Germany and also Italy, Switzerland, Paris, Mexico, and I have visited 32 states here in United States with my training on the power of cultural validation.
Mm-hmm.
My that training is awesome, and later down the road we can talk about that training. But
Mm-hmm.
what I have seen about the partnership is that what I saw in Paris, the people are very straightforward, and
Mm-hmm.
the co-presenters were being straight up honest, talking about the discrimination against the Black French and the
Mm-hmm.
Muslims. And,
Mm-hmm.
and I saw how the partnership came together, and they went together to one of the pharmaceutical companies and talk about their ideas, the French, Black, and the Muslims. So I was like, "Ooh, that would be so nice if in United States the Black and Latino community could start a coalition where we
Mm-hmm.
can all talk about our challenges, not only with the community, but amongst each other, and being honest and truthful. So we can then, once we talk about each other and say what are our challenges about working with each other, go to a pharmaceutical company and say, this is the project we have. For example, you guys work extremely well with churches, we do too. I have a program that is called Vaccine Sunday, where I combine theology, science, and community. So I will speak at the pulpit and talk to the community about vaccines, but with the homily of the day, right? And I think that church movement among Black and Latinos should happen at a national level, but it hasn't happened yet, where we're
Mm-hmm.
both united.
Mm-hmm. Mm-hmm.
So that's one of the ideas I thought that, oh my God, what about if that would happen, especially for funding? Now the funding is going to be limited to a lot of us.
Mm-hmm.
And so we need to be very creative and pivot.
Right, right. And, one of the things that we've been talking about is how to not rely so heavily on government funding, because in different states, different counties, and just overall in the United States, those funding priorities are going to shift with this new administration. And that's the case all the time. We're constantly shifting with new administrations, whether we continue to be led by Democrats or shift to being led by Republicans. Government funding is oftentimes not sustainable because, most elected officials have 4-year terms. If they're lucky, they have an 8-year term. They also have, some of them have 2-year terms. And to affect community change and public health impact, it's going to take much longer than that because, Julissa, the things that we talk about today, they didn't just start 4 years ago. They didn't just start 2 years ago. We're talking about deeply embedded systems, belief, behaviors, attitudes, perceptions that are going to take a much more long-term type of commitment, financial commitment, and time commitment for us to see real change. And so as we're thinking about whether it's laws, policies, and programs, we also have to get creative about who we can approach outside of the government system and who's going to stand up to make themselves available to us, right? As funders, as philanthropists, as major donors, their money where their mouth is. Do you have any thoughts about the financing side of that and how to get more creative with funding these different innovations that we need to make sure our communities are more healthy and equitable?
When it comes to funding, it's something that I need to think about also and pivot to. So I don't have 100% the ideas, but I know everyone knows how to go after funding for the pharmaceutical companies, writing grants and all of that. But now with federal dollars, I just don't know what's gonna happen after January 1st, and I am just waiting to see in order for me to act and react. you know?
Thank you for joining us on Questions You Didn't Ask with me, Niasha Fray, and my guest, Julissa Soto. Tune in next week as we continue our series, Ready or Not, the real talk Black and Latino communities need.